ನಮಸ್ತೆ. ನನ್ನ ಹೆಸರು ಅಬ್ದುಲ್ ಹಮೀದ್. ಯಾವುದೋ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೋಸ್ಕರ ಚಿಕ್ಕಮಗಳೂರು ಜಿಲ್ಲೆ ಕೊಪ್ಪ ತಾಲೂಕು ಹರಿಹರಪುರ ಎನ್ನುವ ಒಂದು ಊರಿಗೆ ಪ್ರಯಾಣ ಹೊರಟೆ. ಹೋಗುವಾಗ ನನ್ನ ಸ್ವತಃ ಗಾಡಿ 2 ವೀಲ್ ಇತ್ತು. ಆ ಗಾಡಿಯಲ್ಲಿ ಹೋಗುವಾಗ ನನಗೆ ಗೊತ್ತಾಗದೇ ಇರುವ ರೀತಿಯಲ್ಲಿ ಹಿಂಭಾಗದಿಂದ ಬಂದು ಒಂದು ಕಾರು ಆಕ್ಸಿಡೆಂಟ್ ಆಯಿತು. ನಂತರ ಅಲ್ಲಿಯೇ ಬಿದ್ದೆ. 1 ಗಂಟೆಯ ನಂತರ ಅಲ್ಲಿಂದ ನನ್ನನ್ನು ಯಾರೋ ತಿಳಿದವರು ತಕ್ಷಣ ತೆಗೆದುಕೊಂಡು ಹೋಗಿ ಕೊಪ್ಪ ಹಾಸ್ಪಿಟಲಲ್ಲಿ ಅಡ್ಮಿಷನ್ ಮಾಡಿದರು. ತಿಂಗಳವರೆಗೂ ಹಾಸ್ಪಿಟಲಿಂದ ಡಿಸ್ಚಾರ್ಜ್ ಆಗದೆ ಅಲ್ಲಿಯೇ ಸತ್ತೆ. 1 ವರ್ಷ ಕಾಲವೂ ಕಳೆದೆ. ಆನಂತರ ಹಲವಾರು ಬಾರಿ ನನ್ನ ಕಾಲುಗಳನ್ನು ಕೈಯನ್ನು ಆಪರೇಷನ್ ಮಾಡಿದರು. ಆ ಆಪರೇಷನ್ಗಳಲ್ಲಿ ಸಾಮಾನ್ಯವಾಗಿ ಸರಿಯಾಯಿತು, ಬರುತ್ತಾ ಇರಿ ಅಂದ ತಕ್ಷಣ ಹಾಗೆ 1 ವರ್ಷದ ನಂತರ ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡಿ ಮನೆಗೆ ಬಂದೆ. ಮನೆಯಲ್ಲಿ ಸ್ವಲ್ಪವೂ ಅದು ಸರಿ ಕಾಣದೇ ಇದ್ದ ಹಾಗೆ 4-5-6 ವರ್ಷ ಅಲ್ಲಿಯ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡೆ. ನನ್ನ ಮನಸ್ಸಿನ ಎಲ್ಲ ಧೈರ್ಯವನ್ನು ನಾನು ಕಳೆದೆ. ಇನ್ನು ಮುಂದೆ ನನ್ನ ಕಾಲು ಸರಿ ಮಾಡಲು ಯಾವ ಡಾಕ್ಟರ್ಗಳಿಂದನೂ ಇರಬಹುದು ಎನ್ನುವ ಒಂದು ನಿರೀಕ್ಷೆ ಇಟ್ಟು ಅದನ್ನೆಲ್ಲ ಬಿಟ್ಟು ಮನೆಯಲ್ಲಿಯೇ ಸ್ವತಃ ನಾನು ಮನೆಯಲ್ಲಿದ್ದೆ. ಹಾಗೆ ಮೆಡಾಕ್ ಲೈಫ್ ಹಾಸ್ಪಿಟಲಿನ ಕಾರ್ಯಕರ್ತರು ನನ್ನೊಂದಿಗೆ ಪರಿಚಯ ಆದರು. ಆ ತಕ್ಷಣವೇ ಹೇಳಿದರು, ನೀವು ಭಯಪಡಬೇಡಿ, ಅದಕ್ಕೆ ಬೇಕಾಗುವಂತಹ ಎಲ್ಲ ಸವಲತ್ತುಗಳನ್ನು ನಾವೇ ಸಹ ಸಿದ್ಧಪಡಿಸುತ್ತೇವೆ, ನೀವು ಬರಲು ತಯಾರಾಗಿರಿ ಅಂತ. ಹಾಗೆಯೇ ಅವರ ಆಂಬ್ಯುಲೆನ್ಸ್ಗಳನ್ನು ಸಹ ಕಳಿಸ್ತೀನಿ ಅಂತ ಹೇಳಿ ಮಾತು ಕೊಟ್ಟರು. ಆ ಮಾತಿನ ಥರದಲ್ಲಿ ಅವರು ಆ ಗಾಡಿಯನ್ನು ಸಹ ಕಳಿಸಿಕೊಟ್ಟರು. ಆ ಗಾಡಿಯಲ್ಲಿ ನಾನು ಇಲ್ಲಿ ಬಂದೆ.
My name is Dr. Darshan Angadi. I'm a consultant orthopedic surgeon. Today I'm here to share with you some of the experiences that we've had in managing the complex problem that Mr. Abdul Hamid presented to us. He was a gentleman who suffered what we call as a road traffic collision and multiple fractures about 12 years ago. Subsequently, he had treatments at local hospitals and underwent an intramedullary nail fixation and numerous plastic surgery procedures. So if I were to draw your attention now to the preoperative X-rays and CT scan, you can appreciate some of the challenges we had. So on the left of the screen, you have the X-rays which demonstrate the AP and the lateral view of his right femur, and he had a intramedullary nail which was much longer than his femur. So as you can see, the proximal or the top part of the nail was quite prominent, and this was irritating his soft tissues, creating pain issues around his right hip joint. Along with it, you can see that the inner part or the medial part of the femur had been weakened significantly, and the previous fracture site was also weakened significantly and had gone into what is referred to as non-union and also had established infection. The other thing which is quite evident on the lateral film is the gap between the top and the bottom of the proximal and the distal part, demonstrating the non-union. He had also got infection which was discharging as a sinus, significantly weakening the bone around the interlocking screw distally. He also underwent 3D CT reconstructions, and as demonstrated here, the old intramedullary nail was quite long relative to his femur length, causing soft tissue problems around the gluteal muscles. He also had weakened bone along the mid shaft and along the distal part of the femur. So these were some of the challenges that we faced in addressing his infection, along with an implant which was there for the past 10 years and had significantly weakened the bone and also the soft tissues which had established infection and were discharging pus in the form of sinuses. So as you can see, Mr. Abdul Hamid had a lot of complex problems given the long established infection in his right femur along with the soft tissue problems. So we had to develop a customized treatment plan, and this involved input from vascular surgeons and plastic surgeons and microbiology specialists. We undertook phased and systematic surgical procedures which involved removing the old or the infected metalwork, dealing with the infection both in the bone and the soft tissues, and then commencing targeted antibiotic therapy based on the culture and sensitivity results from the input of the microbiologists. He has completed all the treatment phases, and I'm glad to report that Mr. Abdul Hamid has now had a successful recovery. He's quite pleased with the outcome. Mr. Hamid is now in much better mental frame because he feels that the limb that he would have lost to infection is no longer the case. He has regained his confidence, and Mr. Hamid is now ready for discharge, and the input from the Medoc Life team would allow him to be transported back to Tirthalli in the ambulance in a safe and secure manner.